My name is Samir Damani. I'm a cardiologist, and this is my second company. My first company is a technology-enabled services company in healthcare as well. So really quickly, show of hands, if you needed to send financial information to someone in the next hour or 2 hours, whether it be transfer money, could you do it? Can I get a raise hands in the audience if you could do it? So most people could do it. Now, if you needed to send a CT, MRI, X-ray in the next hour or 2 hours to a loved one, caregiver, if you needed to, can you do it? Show of hands. Not many. This is why healthcare needs blockchain. So what I'm going to tell you about today is a worldwide crisis that has a blockchain solution. So 40 of the 56 million annual deaths globally occur from preventable and, more importantly, reversible conditions. If you look at the World Health Organization, the CDC, about 80% of all heart disease, diabetes, and stroke, and about 40% of all cancers can be prevented by simply optimizing a few levers: blood pressure, diet, nutrition, tobacco use, alcohol, and obesity. And right now, we're facing a global epidemic because of an expanding middle class. There are 300 million pre-diabetics in India today, more than every person in this country. And there's 10,000 people turning 65 every day. So in the next 10 years, we're going to have 100 million people over the age of 65, 90% have chronic disease. And that's why you see this graph on the right, which shows our budget in the US alone going to $5 trillion, 90% of which is actually related to chronic disease and chronic disease care. And part of the problem is that the data silos that exist today, clinical, behavioral, medical imaging data, sits in different silos. So patients are passive. They don't think they have control of their health. And therefore, doctors are frustrated because they're not treating something with a vaccine or antibiotic. And patients are frustrated because they don't have access to the information they need to be empowered. So what blockchain does is it takes the permission access that's required today to move data, health information, and allows you to store that data in the cloud and use the blockchain as a global HIPAA log, a ledger, so that data can now move like fluid, enabling true data liquidity. So Mary goes to her doctor, Dr. Jones, who's her family practice physician, is able to port her data into a cloud, a personal cloud storage. Health data is not stored in a blockchain. It's just a personal cloud storage. It's protected by the blockchain because permissions are then granted through the blockchain. And she's not only putting her X-ray, MRI, blood pressure, and medication data, but she's putting all her nutrition information, her steps, her activity, all the things that are contextual information that drive better predictive capabilities of doctors and patients to understand the behaviors that they have that are driving disease. And so that's how data liquidity is enabled through the blockchain. But the question is, well, how are you going to drive adoption? We all know that Microsoft Health Vault tried to create a personal health record. The problem with that is they never tied it to any kind of ROI, return on an investment for anyone that did it. And this is where the vitamins, our utility token, comes in hand, where we're now using that as proof of health. And all vitamin sales, 10% of vitamin sales will go to the Mint Health Security Token holders, which is how we're raising funding for the company. It's through the Mint Health Security Token. And I'll tell you a little bit more about that in just a moment. So as I mentioned, vitamins are proof of health because patients with diabetes, heart failure, obesity, hypertension, stroke, cancers, post-op hip and knee replacement patients are going to be incentivized by payers, insurance companies, self-insured employers, people that are taking care of those patients, are responsible for paying for those patients. They're going to incentivize patients to use their data, to put their data in the cloud. And for doing that, they're going to get a ROI, because if you proactive manage a population, we know by just touching 3 to 4% of all diabetics with high-touch care, with patients calling them, using something, that you can drive significant ROI. And we've seen that with my other company. I'll talk to you about that in just a moment. So the vitamins will be used for incentivizing healthy behaviors, for establishing the self-sovereign identity, compensating the providers for success of a population, and providing ecosystem redemption so that now, if you're in a health plan, Aetna is buying vitamins, giving it to the patients with heart failure, diabetes, hypertension, and they're redeeming it at CVS, or they're eligible for a better plan, or they're paying down their deductible. So now the patient is at the center of healthcare. So we're bringing together proven intellectual property, over 200 years of healthcare experience, and we're laying blockchain and a token mechanism on top of that. MD Revolution is the first company I founded. We've engaged over 30,000 patients to date. We're the only chronic care management company today that helps physicians leverage reimbursement from the Center for Medicare and Medicaid Services for several new codes, and we were able to show that for every dollar spent by the Medicare on patients through our platform, we were able to generate $5 in savings for inpatient hospitalizations. We reduced inpatient hospitalizations by half for conditions like heart failure, COPD, sleep apnea, hypertension, and you name it. And we've raised over $50 million. We've had entities like Medtronic and several other venture funds come into the company, and we're bringing that IP to Mint Health along with Nucleus Health, which is a data imaging platform, which essentially has created a blockchain prototype for sharing of medical images. So they're taking medical imaging from Blockbuster to Netflix. High level, from a competitive landscape, you see a lot of companies that are now talking about how they can move data using data liquidity, but nobody has built a model where incentives are going to drive the adoption. The key is adoption, and we are actually a platform as a service, so we're augmenting, enabling other apps that want to create a data liquid environment and an environment where they can manage. So ResMed, Higgy, any app you can think of that is currently managing patients can be blockchain token enabled. Think of us as the Intel inside. So in summary, global pandemics, the preventable and reversible chronic conditions are resulting in unsustainable socioeconomic conditions. Healthcare will be one of the top 1 or 2 markets that are impacted by blockchain technology in the world. Mint Health is a decentralized platform as a service that allows existing apps and healthcare businesses to access a portable and secure patient control repository of data, and digital incentives rewards behaviors to drive customer loyalty and patient engagement. We have a Microsoft code development partnership. They are actually funding the development of our code into production with consensus. We have a rapidly growing sales and investor pipeline, and we have a dual token structure that is novel in that not only will the Mint Health security token holders own equity in Mint Health, but they will also get a 10% revenue share. And we are right now, we have a CF that's live, and we also are raising 10 to 15 million in a Reg D exempt process, and we're exploring filing a Reg A. And here are some of the companies that we're working with right now. And so at this point, I'll pause and take questions.
So how is this different from the Cedars-Sinai network? If I have a doctor at Cedars-Sinai and I go to other doctors there, everything is all in one place on their system.
This combines all your data. It combines your health kit data, it combines your blood pressure data, it combines your scale data, and on top of that, what you're doing is you're getting a token that can be redeemed across stakeholders. So you're actually getting rewarded for actually certain behaviors. So Cedars-Sinai would use us. We wouldn't displace their app. They would just take our app, and then you would get vitamins that could be used for Uber to get you to your office appointment. It would be used at CVS to pay for your prescriptions. So we're not trying to displace Cedars-Sinai. We're enabling them through a token and a blockchain capability.
Hey, it's me again. I have another question. Could you go back to your the most previous slide, please?
Which one?
I think the one you just ended with. It's the one where you're talking about.
It's not letting me go back.
Well, that's too bad. The first point was regarding, it mentioned human suffering. And the point that a lot of the panels have been harping on is if you're going to create a token, make sure that your token has some sort of intrinsic economic viability. And the way I look at it, and perhaps it's overly cynical, is that the hospitals benefit from human suffering. So why would they want to engage in a system that helps people prevent diseases? I mean, if you were going to tell Kaiser, hey, I have a great way to stop half of your diabetic patients from coming in, aren't they going to say, well, great, get the hell away from me?
You know, they're telling me I don't have any time. Is that correct?
Well, maybe we can talk after.
All right, this is it. So the long story short, right now those hospitals are actually getting hit hard by governments because the rate of rise of costs is so high, the reimbursement is going down. So they're forcing more care out of the hospital. So they are incentivized. The government, without the government tailwinds or without the cost tailwinds, it would be very hard to do our model. But vitamins are actually driving ROI because, as I mentioned to you, high-touch care keeps patients out of the hospitals. And now a lot of these health systems that profited from it are faced to keeping patients out. So they want to work with organizations like us. That's the long and short of it.